Hello, Geneva, and welcome to Officially Speaking. I'm your host, Kevin Starr. Each month, we sit down with one of our local elected officials or appointed officials to get the latest with your city government. Today, we're joined by two members of the Mental Health Board, Suzy Shogren and Eleanor Hamilton. Ladies, thanks for being here today.
Thank you for having us.
Why don't we start off the show by giving our viewers a little bit of background about the Mental Health Board.
Well, the Mental Health Board came into existence after the passage of federal legislation, and the Illinois General Assembly in 1963 created the Illinois Community Mental Health Act, and that allowed municipalities to go ahead and seek approval through referendum of their voters for a tax levy on property. And so in 1989, the voters of Geneva passed a referendum to do so. So we are a 7-member board that is appointed by the mayor, and we serve 4-year terms.
And Eleanor, can you tell us a little bit more about the mission of the Mental Health Board and what you strive to do here in Geneva?
Yes, several years ago, we created a mission statement and a strategic plan for the Mental Health Board. I can read you the mission statement. The Mental Health Board supports mental health funding, advocacy, and education with the focus on providing assistance to Geneva residents in the areas of developmental disabilities, mental health, and addiction substance abuse needs. So while our funding goes out to service providers in many areas, all of them fall within one or more of those categories. Our current mental health board is a wonderful board with people from diverse backgrounds. Some people have served in the mental health field, some people in education, some people in health-related fields, some people in the business community, and we have also a parent of a special needs child. So we have a real diversity of perspectives on the board, which is very helpful.
And Suzy, I know with so many different mental health needs out there in the community, how do you go about striving to meet that mission on a daily basis?
So our primary responsibility is to, as a board, is to dispense approximately $155,000, and we do that through a grant application process. Nonprofit service providers can apply, and in that application, we seek specific information from the providers, such as the number of Geneva residents they serve, and a somewhat detailed explanation as to how they would utilize the funds. We also ask for quantitative and qualitative numbers and data to support what their request is and their desired outcomes. We also attempt to familiarize ourselves with the service providers in our community by inviting them to some of our monthly meetings, and we often have the executive directors of those organizations speak to us, and they share with us their intimate knowledge of the community needs. We have also had the opportunity to accept an invitation from Judge Clint Hall to attend the Treatment Alternative Court, so we sometimes get to experience firsthand some of the services that are provided. And finally, some of our members have been able to attend the Association of Community Mental Health Authorities of Illinois' quarterly meetings, which allow professionals in the behavioral health field speak to anyone who attends in a seminar type fashion, and they have the local authoritative knowledge that helps us immensely.
Eleanor, can you share with us a little bit about how some of our groups that receive the funding, how do they use that to benefit Geneva?
Well, first of all, I think it's important to know that we fund a variety of service providers. This year, at our November meeting, which is our annual funding meeting, we provided funding to 11 service providers in these 3 fields of mental health, developmental disabilities, and substance abuse. In the mental health field, we fund service providers such as Tri-City Family Services and the Ecker Center. In the developmental disabilities field, we fund service service providers such as AID and Day One. In the substance abuse field, we fund RENS addiction counseling. And then there are other agencies, service providers that apply to us that have individuals in more than one of these areas, such as Lazarus House. So we fund in a variety of areas and a variety of service providers. Some of the ways these service providers use funds are to compensate professionals because some individuals don't have insurance or they don't have adequate insurance, they have high deductibles. The agencies will have a sliding fee scale so that people are only paying what they can afford, but that leaves a gap, of course, and a need for funding. There's also a need for all service providers to transition to electronic records, and that's an expensive process. And finally, some service providers use funds that we provide for supporting at-risk populations so that they're not moving along and developing more severe problems. One of the wonderful things about the Geneva Mental Health Board is that we're able to fund all of those service providers, all 11 service providers in all of those areas at a very important level for less than $7 per person here in Geneva.
Well, that's great. Suzy, there's probably a contingency of Geneva that's probably not even aware that the Mental Health Board exists. How do you go about educating the community about what resources your team can provide?
Well, a perfect example would be that we tried to get the word out that May is National Mental Health Month. And in previous years, we've worked collaboratively with the public library and the middle school and high school libraries and the head librarians, and they have been able to provide a display with mental health awareness materials. We also engaged the service providers that received our funds and asked them to provide a list of pamphlet material for individuals to look through, even to take away if they so needed that service. We've also tied green ribbons around the block here at City Hall during the month of May to bring awareness. And you know, while we as a board are not a service provider, we would always be a resource for people to come to if they had questions about where to go and who to seek assistance from.
So if I was looking to find more information about the Mental Health Board, how would I go about doing that?
So we are on the City of Geneva's website. If you go to the website, there is a left tab under City Government and then Boards and Commissions. If you click on that, and our information is under Mental Health Board. So we're right along with the city.
And when do you guys host your monthly meetings?
We have the monthly meetings the second Tuesday of every month, right here in City Chambers at 7 p.m. It is an open meeting, so anyone from the public is invited to attend.
That is all the time we have for Officially Speaking today. I'd like to thank Suzy Shogren and Eleanor Hamilton for their time and insight into the Mental Health Board.
Thank you for having us.
Thank you.
We also thank you for watching. We hope you tune in next time to get the official word on your city government.